What if your eyes, right now, are sending out secret signals about your health? We've all heard that saying, they're the windows to the soul, right? But for a doctor, they're more like a diagnostic dashboard. So in this explainer, we're going to decode the fascinating stories your eyes are trying to tell us.
Okay, let's just dive right in with a question I think we can all relate to. Have you ever woken up with that little tender, super annoying lump right on your eyelid? Yeah, I'm pretty sure we've all been there at some point.
Now think back to that lump. Was it actually painful when you touched it? Because that one little detail, that single word, is a massive clue for a doctor. In the world of diagnosis, painful versus painless can point to two totally different things. It changes everything.
So how are we going to figure all this out? Well, we're doing something a little different today. We're going to peek behind the curtain and actually learn to think like a doctor. And to do that, we're going to use real patient cases pulled straight from a fourth-year medical school ophthalmology exam. This is our source material, and believe me, it is packed with clinical mysteries for us to solve. So welcome to our virtual clinic. Our first stop is going to be the place where a ton of eye issues start, the eyelid. Let's start decoding some of the most common complaints.
And here we go. Our very first mystery is basically solved right on this slide. On the left, you've got your classic stye. It's red, it's angry, and yep, it's painful. That's an acute infection. But look over on the right. It might look kind of similar, but it's a whole different story. Our exam source describes this as a painless swelling that's been hanging around for months. That, my friends, is a chalazion. It's just a blocked oil gland. So what's the key difference? Pain. One single word completely changes the diagnosis.
Of course, it's not always about lumps. Check out this next case file from our source. A 6-year-old comes in with sticky eyes and, get this, dandruff-like scales. Those are the magic words right there. That description instantly makes the doctor think of a condition called blepharitis, which is just an inflammation along the edges of the eyelid. See? It's all about listening to the story and picking out those key descriptive details.
All right, let's move on to our next consultation room. We're going to level up here, from sort of common irritations to something that sounds a little more dramatic, the mystery of the protruding eye.
Now, the official medical term for this is proptosis. It's just when one or both of the eyeballs start to bulge forward. It can be a pretty alarming thing to see, and the cause isn't always obvious. This is where a doctor's detective work really gets put to the test. So let's look at our first case file. We've got a 32-year-old man. The key clues here are absolutely fascinating. First, the proptosis is described as pulsatile, which means the bulge is actually throbbing, just slightly, in sync with his heartbeat. Wow! Second, he has a history of a recent head injury. You put those two facts together and it's a classic sign of something called a carotid cavernous fistula, basically an abnormal connection between blood vessels behind the eye caused by the trauma. Now let's contrast that with our second case file, a 45-year-old patient, also with a protruding eye. But the story here is completely different. There's no trauma, there's no pulse. Instead, the big clue is that they suffer from thyrotoxicosis, which is just an overactive thyroid. This immediately points the doctor towards an autoimmune condition known as thyroid eye disease. And this is exactly what makes medicine so challenging. As you can see here, a single symptom like proptosis can point in so many different directions. It could be an autoimmune thing like thyroid disease, which we just saw. But our medical exam also gives us cases caused by physical trauma from an accident, a tumor growing behind the eye, or even a really bad sinus infection. A doctor has to weigh all these possibilities based on the patient's unique story. Okay, for our final stop in the clinic today, let's solve the most common eye complaint of them all. I'm talking about something we have pretty much all experienced, the dreaded red eye, or pink eye. Think about it. When your eye is red, it can feel gritty, or watery, or just sore. There are a lot of potential causes. So let me ask you, what is the one single symptom that is a dead giveaway for allergies? Itching. That's it. An intense, undeniable, I have to rub my eyes right now kind of itch. Our source material from the exam actually calls itching the hallmark symptom of allergic conjunctivitis. If that is your main complaint, especially if it happens around the same time every year, allergies are always going to be the prime suspect. So yeah, not all pink eye is the same. This little chart, which we built from the exam cases, breaks it all down. Look at that top row. If the main symptom is that intense itching we talked about, it's almost certainly allergic. Now look at the middle row. For viral, the main feeling there is more of a gritty, burning sensation. And finally, the bottom row, bacterial. The telltale sign here is that thick, pus-like discharge that can literally glue your eyelids shut in the morning. 3 different causes, 3 totally distinct signatures. Okay, let's step back for a second. After looking at all these cases, from simple eyelid lumps to complicated red eyes, what have we really learned about how a doctor thinks? It's really all about recognizing the pattern.
It all boils down to this really elegant four-step process. First, and this is the most important part, you have to listen to the patient's story. Next, a doctor has to identify those key descriptive words, the clues like painful, or pulsatile, or itchy. Then, they consider all the different conditions that could possibly match those clues. And finally, they form a diagnosis by putting all those pieces together to solve the puzzle. It's like this systematic art of deduction.
And this, to me, is the most amazing part. The eye doesn't just tell you about eye problems, it can reveal secrets about your entire body. We already saw how thyroid disease can show up in the eyes, but our medical exam also links other big-picture conditions, like the autoimmune diseases sarcoidosis and ankylosing spondylitis, to specific kinds of eye inflammation. It really proves that your eyes are, in fact, windows into your overall health.
Which, of course, leaves us with a final, fascinating thought. After seeing how just a few key symptoms can tell such a detailed story, it really makes you wonder, doesn't it? What other secrets about our health are our eyes just waiting to tell us?